Hi, this is Dr. Jason O'Connor from O'Connor Chiropractic. Today we're talking about women's health. Obviously Mother's Day is coming up, so I really want to focus specifically on looking after you women. And always when I talk about any aspects of health, when I'm looking at it from a chiropractic kind of standpoint, we always look at what's the root cause of these issues. So that's where I'm going to be coming from and how do we address those. And always starting from the premise that we're genetically designed to be healthy. So when we're not expressing health, we go, well, why are we not? What's causing that? What's interfering with that kind of natural inborn intelligence which is within the body? And we've just got to kind of look at what we're doing day to day and what are the main kind of stresses. And when we look at stresses, we look at physical stress, traumas, kind of emotional stress, and kind of toxins. So we'll talk a bit about that and how it has a huge impact on some of the problems that we're discussing. So things like dysmenorrhea or painful periods, kind of menopause, kind of symptoms associated with that. We'll talk a little bit about the contraceptive pill, HRT, another hot topic is kind of osteoporosis, so I'll try and cover all of those and how we can naturally address these and just get better outcomes for your health. But I think a lot of it, like I say, women are kind of really messed around with, and what I mean by that is straight from being young, even when women first start their periods, often like a viable kind of treatment for that is, let's straight on the contraceptive pill. And then, as you know, going through menopause, HRT, and often, we're given other kind of medications to treat these symptoms. And what's happening is the women's hormone levels are going very up and down. And interesting, another kind of way of treatment is quite barbaric in terms of like hysterectomy. Now, don't get me wrong, sometimes it's kind of essential, but the word hysterectomy, I don't know if anyone kind of has an idea where that word originates from, but it was actually a male surgeon, and you think of like appendectomy or any ectomy is like a removal, and so hysterectomy, the first part of the word hysteria, so it was basically designed to remove hysteria for women, for hysterical women. So again, it's not really looking at why are these women getting these symptoms, it's saying, let's just kind of remove it. And often I feel that these kind of quite harsh interventions are done too early instead of looking, what's the cause of it. So we'll look at kind of some dietary advice, some lifestyle advice, also chiropractic. So how can chiropractic help? Because a lot of people confuse, well, if I've got painful periods, what's the relation to a chiropractic adjustment? Or, if I'm going through the menopause, why would chiropractic help me? So we'll kind of cover that as well. But yeah, just starting, like I say, we'll start at the beginning. All women have, healthy women should have periods and go through a menstrual cycle. But if you think the symptoms of those can be so variable, like some women seem to go through it and relative ease, and other women can be, bedridden, can't work, severe mood swings, which affects, them, their family, their work, and there is such variation, isn't there? So we think, why is that occurring? And obviously, there's genetic differences between people, but I also come back to, again, we're not really living congruently with our genetics. So, a lot of, look at the diets we eat, so high in sugar, lots of foods which are full of artificial sweeteners, artificial colorants, lots of foods that can mess with hormone levels. So again, you might not realize, but soya is used a lot, not just for people who are looking for dairy alternatives. If you look at a lot of foods, soya is like a lot of a bulking agent. Now, interesting, soya kind of mimics the same effects as like estrogen. So again, if you're eating foods that we're not actually designed to eat, and that can have an impact, on hormone levels and the regulation of those hormones. So yeah, I'd always look at first at, what is the diet like? Are we having a lot of processed foods? Are we on any current medication that can be reduced or stopped? Stress levels. So again, we know without doubt that when we're releasing stress hormones, that cortisol, adrenaline, any hormones that you change in the body has a cascade effect on other hormones. You can't just change one hormone in the body and it not affect lots of other hormones. So again, if other hormones are out of balance, so again, if someone's suffering from anxiety, stress for whatever reason, and especially teenage years, they can be very difficult. We just have to look at now the pressure, social media, suicide rates, all these things. So we know for certain, the young people of society certainly experiencing high levels of stress earlier on. And if at that time in their life their body's going through a transition as well, and the hormone levels are changing, you can see how some people might struggle with that more. So what I'm saying is it's not necessarily the right idea to think, okay, we're getting all these pain symptoms because we're not regulating hormones very well, so let's just add in some artificial hormones, let's trick the body thinking it's pregnant, so then we stop getting these painful periods and we reduce the symptoms. Because the problem is even if, let's say, it works really well and you take that contraceptive pill, what we're finding is a lot of women can be on them for years, decades, before they're actually ready to have a child, and then they get to a point where I think we want a child now, and they start trying for a baby, and they stop the pill and they think, all right, I'll be able to conceive straight away. And often what we're finding more and more is they're really struggling then to conceive, and it can be years afterwards because of the effects that those artificial hormones have had on that woman's natural kind of cycle. Now again, there's all the things that we could talk about, like polycystic ovaries, endometriosis, and other things which again can be linked to abnormal kind of hormone levels. But it's like what usually then happens is we get more and more intervention, so that can lead to further hormone treatment, hormone patches, and then later on they've shown there's much more likely of then having further surgery, so things like, again, leading on to hysterectomies, or like you say, then struggling in the menopause. So the same kind of patterns we see if women struggle quite a lot earlier on when they start the periods, then they're usually going to struggle quite a lot later on as well. So which again, it's just the body not self-regulating too well. And I think again, it's too easy to then jump in and think, right, okay, we're getting these symptoms, we're getting these hot flushes, we're getting these joint pains, we're getting these hot mood swings. So let's put another hormone in. So we're getting hormone changes from our diet, we're getting artificial hormones early on in life, then we're getting continual hormone changes, and then again later on in life we're getting HRT, and you can see all these different things will have a knock-on effect. So we know the uptake can affect the uptake of calcium in the body, which can then lead to osteoporosis. So like you say, it's just like a perfect storm that kind of one leads into the other, and we just get these cycle of problems. And instead of stepping back and say, well, hang on, what do we need to do things a bit differently? Because what we can see is that the more intervention, the more these drugs, that we can see a pattern where we're getting more kind of issues with health and diseases. So things, heart disease, so that they've shown that there's an increased risk of heart disease, stroke, with long-term use of these tablets, specifically HRT, cancer rates, breast cancer, ovarian cancer, and then also demineralization of bone, so not uptaking calcium very well. So you see this one thing lead on to another, onto another, onto another. So what I'm saying is, if we try and get back to what we're specifically designed to do, so maybe we should be looking at eating a lot more fruit and vegetables, a lot less kind of diet that pushes us towards this chronic inflammation. So like we said, high sugar, artificial foods, we know that creates more inflammation. We know that increased inflammation leads to increased stress hormones, cortisol, which then has a knock-on effect, things like adrenaline levels, which then affect other hormones like dopamine, serotonin, so mood swings. So we can see these patterns coming on, so we want to try and shift away from that, and like you say, one of the things that I always advise people is to reduce actually dairy, because a lot of people think as well, going back to the osteoporosis and the soya issue, is we get a lot of calcium from dairy, and we've all seen dairy adverts have, gives you strong teeth, strong bones. It's a complete lie. The country that consumes more milk per head than any other country in the world is America. They also have some of the highest rates of osteoporosis in the world. Some countries that consume no dairy have like China, have much lower rates of osteoporosis, have much reported less kind of issues with menopause. So I definitely think like our consumption of dairy doesn't help at all. So yeah, reducing the amount of milk, yogurt, cheeses, concentrated dairy if you like, but not going for the soya alternatives. Well, you're probably thinking, well, what can I have? So things like almond milk, coconut milk, oat milks, they're all really actually high in calcium as well, but don't have that impact on the hormone levels. So I'd certainly go for that, and as I say, green leafy vegetables, spinach, broccoli, kale, they're fantastic. Go for juices, smoothies, just trying to uptake more nutrients, healthy nutrients into the body in the most natural form. Because if you think, all right, I've got low bone density, I'll increase my calcium intake. The body's not used to absorbing it in that form, so a capsule form. So we find that you could have 10 times the RDA recommended daily allowance, but your body's not absorbing any of it. So you want to get it to in a form that the body's used to consuming and is much better at taking it from. Another thing that's really key is vitamin D. So to do with the absorption of calcium, you need to have good levels of vitamin D. And obviously in this country, although the sun's shining through on me now, it's probably the first time this year, but yeah, it's rare that we're getting enough sun to get good levels of vitamin D. And we actually need to have our torso exposed. So it's rare that in Harrogate we'll be walking around with our torso exposed, absorbing enough vitamin D. So obviously supplements it. We've got a great one in the clinic, the vitamin D spray that you spray underneath the tongue, which again absorbs it a lot better. Now what's really key in this, so you could be having enough calcium in your diet and eating it correctly, you could have enough vitamin D and supplement vitamin D, but unless you have load bearing exercise, it doesn't mean a thing. It's a bit like these protein shakes, with the bodybuilders trying to build muscle. Imagine if you drank protein shakes all day but then sat on the sofa, would you build bigger muscles? Of course not. So again, you consuming all this calcium and vitamin D, but if you don't actually load the bones, and what I mean by loading the bones is, walking's great, but actually resistance exercise. So you can use like bands, weights, and it's interesting, people, especially women, I think, as they get older, they'll probably avoid, even if they go to the gym, they'll probably avoid doing weights. But they're actually crucial in terms of keeping the bones strong. Interesting study, they looked at the astronauts that went up to the space station, and what they found is even after a few weeks of when they came back up in space, they all came back with osteoporosis. So these are really fit, healthy people, almost athletes, if you like. That's how the fitness standards are going to be an astronaut. But when they came back and they retested them, they found, gosh, yeah, the muscle density lost, bone density, and what they found, it was zero gravity. So like I say, you can be young, fit, healthy, but if you're not actually loading those bones, the body's like use it or lose it, so it demineralizes the bones. And the reason why, talking about demineralization, because I said about not how, dairy and how it's bad for you. The reason why they've found that dairy, even though it's got calcium in it, don't get me wrong, it has got calcium in, it makes the body more acidic. So what the body does is, there's all good cheese that our pH levels are too high. I'm going to take calcium from our bones, so it kind of leaches calcium from our bones to decrease the acidity and make us more alkaline. So that's how consuming dairy can cause osteoporosis. So like you say, eating the correct foods, getting the right supplement, and key is get that load bearing exercise. Start doing resistance, start doing the weights. Not only look better, but we know that that'll protect our bones in case we have a fall. The statistics on are really quite poor, that often if people fall and they fracture a hip, the mortality rate within that year is really, to survive another year is really quite poor. So that's why we want to avoid obviously getting it to that kind of crisis stage by preventing the osteoporosis. So I think we covered a bit on that, and obviously what can affect hormones. And again, people are thinking, oh geez, that's a lot to change. That's, it's a lot. I love milk, I love cheese, I don't really like doing weights. And people might think that's quite a drastic thing to do, but the effects these health challenges have on your life and how big an impact they can have. I think they're small sacrifices. And it's interesting that when we were talking about hormone changes and genetics, and people have, I don't know if you've heard, like in the news, you've probably heard of Angelina Jolie, several other, a few other famous people who've elected to have mastectomies, have had their breasts removed or their uterus ovaries taken out. And the thought behind that is that they were told that they had the gene for that cancer, so they were more likely to get it. So if they removed those organs, that reduced the risk of getting it. Even though there's been evidence of women having mastectomies and still getting cancer. And I just think that's just mind-blowing to me. So even though we know the rates, if you think about that for a moment, the rates of all these the things that we're talking about, so breast cancer, ovarian cancer, in women are on the rise, but we know that the genes have stayed the same. The human genome has changed 0.02% in 40,000 years. So we've got the same genes, but we know the rates of these illnesses are growing significantly, and also in more westernized societies. So we know it's got to be the way we're living, and we feel it's a viable option to remove our organs to prevent us getting cancer. So I think that's quite warped, and we should maybe really think, well, what's the cause? And as I said, starting going down the surgical drug route is thinking, well, how do I get my body to express better health? How can I be more congruent? And all of us can look at our lives and think that a lot of people get up in the morning, and I've said this before, drive to work for an hour, sit at a desk 6 7 hours, eat processed easy food, drive back again, sit on a sofa, put Netflix on, open a bottle of wine. Hopefully it doesn't sound too familiar, but it's just understanding that we're not designed to do any of that. We're hunter-gatherers, so we're designed to move every single day, and to be bending, lifting, twisting, to gather our foods, and to do these kind of routines that maintain good health. If you took an animal from the wild and you put it in a cage and you fed it all the wrong foods, what would you expect that animal to be? You'd expect it to become overweight. You'd expect it to become depressed, stressed. You know that the rates of diseases in that animal would like to go up, and it certainly wouldn't be happy. Well, that's what we are. We're like caged animals, and a lot of these kind of conditions and diseases are a result of that. Is we're not fully functional, living optimal health, and we get then these symptoms, and then we just think, oh, let's throw medication at it, and if it gets really severe, there's an operation that can kind of fix that. So, as I say, hopefully looking at a different angle, maybe changing a few things, and just to finish on, with chiropractic care, you think, well, what's chiropractic got to do with it? Well, in our bodies, we've got this innate intelligence. So we talked about, you think about how we're born in the first place. You've got two cells come together, form one cell. That one cell then divides into 2, into 4, into 8, 16, 32, 64, and so on. And in 9 months, this is grown within your wonderful woman's bodies. In 9 months, we have a perfect human being, from one cell. That one cell knows to arrange itself into all those other different cells, heart cells, lung cells, liver cells, kidney cells, and create this, perfect baby. And does that intelligence just stop? No, of course, that intelligence is with you till your dying breath, and it's keeping you alive, and it's using all the nutrients that we give it to express health. Now, how does it control the body? Well, through the central nervous system, through the brain, through the spinal cord. As a chiropractor, what I'm looking at when I'm assessing you is like, well, how well is that system working? Is there any interference with that system? Is there any subluxations in the spine? Because if your spine's subluxated, if it's out of alignment, if you're in that chronic stress posture from living a lifestyle we talked about, what chance has your body got to heal and repair and adapt and balance the hormones in the body? It's going to find it very difficult. So when you're adjusted, we're realigning the spine, we're reconnecting the brain to the organs, we're getting clearer connection, we're expressing better health. So specifically in the women, we'd look at the pelvis, the lower back, carrying children, not only just giving birth, the stress that puts on the pelvis, then carrying babies, then feeding, a lot of the mums I see and this chronically slumped posture because of that, which then can lead on to further problems down the line. So we really focus on getting that natural alignment posture back into the body, getting the pelvis level straight, and then we know at the base of the spine, that lower lumbar spine, where do the nerves go? Everything in the pelvis. So when we're talking about regulating hormones, what regulates hormones? Yes, the uterus is creating hormones, other glands in the body are creating hormones, but they only do when the brain tells it to do that. So, if your nervous system is under stress, if it's not firing correctly, your hormone regulation isn't going to be being controlled and firing correctly. So what we often see is, women can start chiropractic care for maybe back pain, sciatica, headaches, and then they say, geez, since I've always struggled with really painful periods. Since I've been getting adjusted, it's calmed down significantly. Women just have to take time off work. Had then severe headaches, migraines, were always coming around the time of the month, and they stop once they get in chiropractic care. And I'm not treating those symptoms. What we're doing is getting that body back in balance, getting it healthier, getting the nervous system expressing better. And we've even had some women that have struggled to conceive, so they've been trying for years sometimes to conceive, and and for one reason or other they've not managed to do that, and then they've started chiropractic care, and we've got that nerve flow better, we've got that spinal posture better, we've got the hormone balance better, and lo and behold, they conceive. Now, it's not the chiropractic care that's getting them pregnant. What it is the chiropractic care is getting the nervous system working back towards optimal, and they're expressing better health, in their body. So that's why I say, any women of any age, from, and again, I mean this from, the best time to get checked is obviously right at the beginning as a baby, so you can make sure that spine grows and develops healthily. But we've got patients, ladies in the 90s that we're taking care of, and making sure their balance is better, their spine's aligned. So even if their bone density is reducing, they've got much less risk of falling and fracturing their bones, because their nervous system is firing correctly, it's reacting properly, and it's preventing like a fall. Because how many times do we catch our feet and then we catch ourselves? What's doing that? Central nervous system. If the central nervous system firing correctly, the risk of falling is a lot less. So if the risk of falling is a lot less, we know the risk of fracture is going to be a lot less as well. So that hopefully some great tips there. I just want to kind of summarise some of the key things that you can do. Obviously, reducing inflammatory things in our diet, things that are going to affect our hormone levels. So getting the sugar down, alcohol. Sorry about that. Caffeine, artificial sugar, sweeteners, flavouring, all those type of things which can interfere with kind of hormone levels. Get back to more natural fruit, vegetables, One of the things I forgot to mention was omega-3. Omega-3 is fantastic in terms of reducing inflammation, essential for healing, repair in the body, so strongly recommend that. Vitamin D, really important. We said like calcium, but more natural form, because that's how the body absorbs it better. So I say green leafy vegetables, spinach, broccoli, kale, things like the milks, going away from dairy, but not soya, more things like almonds. You get hazelnut milk, oat milk, cashew nut milk. You got all kinds of choices. Coconut milk, whichever you prefer, but moving more towards that. Load bearing exercise, so getting that gravity through your spine, getting that load through your joints, resistance training, weight training, really good. Try and resist going straight for the tablets. You know, if you are one of those women that have been put on really early in life on contraceptive pill, ask some questions, speak to your GP, see if you can look at, you know, coming off them or different alternatives, just to again risk the reducing the risk of effect on long-term health and things like fertility or cancer rates, all those types of things. And again, same with the menopause, see if there's other alternatives rather than going to HRT. I was saying about women with painful periods, and also about women with menopause, because again, if you think, like we said, every healthy woman should have a menstrual cycle, a period. Every healthy woman, a natural transition in life is the menopause as well. But again, just like we were saying, we're getting such differences in women's symptoms with their periods. There's also massive differences in women that go through the menopause. You know, some women will say, "Oh yeah, it was fine. I hardly noticed. It was a breeze," and then other women, absolutely horrendous. You know, and really affecting their quality of life. So again, it's asking those questions: why? You know, how can we shift them more closer to the other women that are kind of transitioning, much more naturally, much less stress, in the body. So, and also, like we said, chiropractic care, really key. You know, your nervous system is central to everything. It needs to be healthy. Get yourself checked, or as a family member, tell them to get checked, get looked at. And as I say, it's Mother's Day. We're doing a special offer, because I say we want to look after you women. You've had a hard life with all these things that we just talked about, looking after us. So we're doing a half price offer, so you can get all the tests on the nerve scans, the X-rays, full evaluation, see what's going on, and then we can give you more specific advice in the clinic as well. If you don't know what exercise to do safely, or you've tried exercise and it's been too painful, we've got Cal, the PT. He's absolutely fantastic. He's worked with a lot of women with osteoporosis, joint problems, pre and post pregnancy, so he can give you specific advice on what are the best exercises for those issues, what to do, what to avoid. He can write you a program to do yourself, or he can watch you and observe you do it, make sure you're doing it correctly. We run Pilates classes here, which again, really safe, great for your bones, your joints, great for reducing stress. Another thing we do is offer massage. So again, massage is brilliant for lots of, it's not just sore tight muscles, it's really about relaxing the body, shifting it from that stress state to more relaxed state. So we call sympathetic over to parasympathetic, helps with drainage of fluid. So there's lots of benefits from massages, from massage as well. So we've got all this help, these services there. We want to help you transition as best you can through these challenges, these problems with your health, and just give you the best advice going forward. So hopefully that was useful. Hopefully, it rung true with some of the things that you've heard or you've experienced. If you've got any questions at all, I'm here to help. I'm happy to get on the phone, or if you want to drop us a message, we'll answer that. And also just take advantage of the offer, come and get checked, and we'd love to take care of you. So we'll hopefully see you soon in the clinic.